A 1 minute warning here when we're just getting set. We'll be streaming live as well. Good morning, everybody, and thank you for coming. My name is Sergeant Jason Robillard. I'm a Media Relations Officer with the Vancouver Police Department. I would like to thank our partners and our guests that are here today to support this worthwhile cause. Superintendent Michelle Davey from VPD, Sergeant Mark Steinkamp, VPD and Odd Squad, Sergeant Toby Hinton, VPD and Odd Squad, Brian Shipper, Odd Squad producer, Curtis Rowe, Telus Community Fund, Jennifer McRae, Ministry of Education, Dr. Gustafson, VCH, Brian Twaits, EHS, Captain Stephen Fulmer, Vancouver Fire and Rescue, Diana Zopa, President of Odd Squad Productions, Michael Taylor, Mark Bodie, Dr. Bill McEwen, and we have representation from the Vancouver Police Foundation. I'm pleased to introduce several guest speakers who are here today to help launch a new educational fentanyl campaign focused on youth, which was created by Odd Squad Productions. Joining us today will be Chief Constable Adam Palmer, followed by Nene Baird from Telus Community Fund. Next will be Sherry Morak, retired school superintendent with Safer Schools Together, and Marshall Smith from the BC Recovery Society. And lastly, we'll have Constable David Stewarding representing the Odd Squad Productions. The speakers will be available for questions, but we ask you please save questions that you may have for after and when the speeches have concluded. I will also be available for any media for other VPD questions not related to today's announcement. Thank you. Chief.
Thanks, Jason. Good morning, everybody. Sadly, fentanyl continues to kill people in our province every single day. So far this year, we have had over 1,000 overdose deaths year to date recorded in British Columbia. I clearly remember the beginning of the fentanyl crisis in Vancouver. It was almost exactly 4 years ago, Thanksgiving, October 2014. Although the number of deaths this year is slightly lower than last year, the loss of even one life is too many, and the total numbers are just staggering. I'm encouraged by the response from the community and the government. New, innovative solutions introduced over the last year or so are undoubtedly saving lives. There are treatment options available in this province, or soon to be available, that simply were not an option at the beginning of the crisis. Treatment is vital to dealing with this crisis, but another key piece to reduce future risk, especially for youth, is awareness, information, and knowledge, which are very powerful, focusing on that very important prevention and education pillar of our approach. That's why, about a year and a half ago, the VPD partnered with Odd Squad Productions to create an educational series for young people to help reduce the risk. Odd Squad has led the project and secured funding from the Vancouver Police Foundation, the Telus Community Fund, and Face the World Foundation. Thank you very much to our partners for your contributions. Odd Squad also connected with the right partners to make this project a reality, including the Vancouver School Board, the Ministry of Education, Vancouver Coastal Health, and Safer Schools Together. Most importantly, they connected with the people impacted by the crisis, including frontline workers and those who have lost loved ones, to help tell their stories. I'm happy to announce that the Odd Squad has produced 3 educational modules that will be rolled out in schools across British Columbia, including right here in Vancouver. They will also be available online at vpd.ca and oddsquad.com. The videos are documentary style and come with a facilitator's guide. Together, the videos and the guide will provide discussion points for teachers, parents, and students on how to address the use of opioids in our communities. I would like to acknowledge Toby Hinton, Mark Steinkamp, Dave Steverding, who are all currently serving and well-respected members of the Vancouver Police Department, as well as being members of Odd Squad Productions. And I'd also like to recognize Brian Schipper from Odd Squad Productions and Diana Zappa, who's here today as well. Thank you for volunteering your time and for your great skill at interviewing, filming, directing, and creating these modules for youth in British Columbia and anybody else who wants to be better informed about this crisis and to help save lives. Thank you.
Good morning. My name is Nene Baird. I'm the chair of the Telus Vancouver Community Board. We have had the pleasure of supporting Odd Squad since 2006. We support them because they're people who are on the street. They know what the youth need to know about. For example, we first funded them in a program to educate youth about the dangers of crystal meth. That was way back in 2006. That was followed by another educational program to educate kids about the dangers of getting involved with gangs. Both of those were tremendously successful and had the impact we hoped they would have in the schools and in community centers around the province. When this proposal came to us, we said, this is a no-brainer. This is such an important issue that affects every child and every family in this province. To be able to give them a small grant to get this project off the ground was something we were very proud of, and I think you should be as well, Chief. So thank you.
Good morning. Safer Schools Together was really pleased to work with Odd Squad Productions to develop the Understanding Fentanyl resource, which we know is going to be well received by educators, schools, parents, and community members throughout our province. Teresa Campbell, president of Safer Schools Together, has served on the board of directors with the Odd Squad Productions for a number of years and has made a significant difference in our province in helping ensure that students receive all of the safety education that they need. Since 2012, the provinces Expect, Respect, and a Safe Education, which we commonly refer to as the ERASE strategy, has supported BC schools and school districts to create safe school cultures, to prevent bullying, and to address other worrisome and harmful behaviors. Addressing problematic substance use is a key component of ensuring safe and caring schools. Unfortunately, drugs such as fentanyl have introduced an entirely new set of risks for youth in our communities. Education, we know, is key to ensuring that students understand the risks of potentially deadly drugs such as fentanyl and other opioids. The Understanding Fentanyl resource will help children and youth make healthy life choices and understand the inherent dangers of fentanyl in our communities. The resource guide has been very cleverly designed so that it's broken down into sizable sequences, which makes it really easy for an educator or others to create passionate and engaging learning opportunities for children and youth of different age groups. The Ministry of Education is also committed to ensuring that BC schools and education partners have access to evidence-based curriculum current resources on overdose prevention and education, and are pleased to share information on this new exciting resource with all of our school districts, superintendents, independent schools, and band schools throughout the province, starting next week with our annual Safe School Coordinators meeting in Richmond. Thank you.
Good afternoon. I'm Marshall Smith. I'm the chair of the British Columbia Recovery Council and lead the recovery division of the British Columbia Centre on Substance Use. I'm thrilled to be here today. Thanks, Chief, for having us, and to Odd Squad for this production. It's been a tremendous honor for me to be able to be here today and to participate in this film. Several years ago, probably I should say, my most important qualification today is that I'm a person in long-term recovery from addiction, and that means I don't use drugs or alcohol anymore. That wasn't always the case for me. There was a time in my life where I lived on the streets of Vancouver, on the east side and downtown, in the throes of addiction and alcoholism. I'm able to be here today because of the gifts that the Chief was talking about, treatment and recovery. And I'm able to be here today because of the connections that get made between the Vancouver Police Department and the people who are struggling in our communities. And I want to take a minute to thank Sergeant Mike Ritchie, who is here who is one of the people responsible for helping me off the street and into treatment. This is an example of the ways that the Vancouver Police operate in our community, helping people, saving lives, and connecting them with services every day. This is a disease, it's a healthcare problem, and it's a problem that works in systems. It doesn't only function in the downtown east side of the city, it functions in every corner of our province, at every kitchen table and every boardroom table, and it knows no socioeconomic boundaries. Videos like this will help connect people to solutions. I'm proud to be a part of it, Mark, and to the Odd Squad. This is an excellent production that will live on with our young people over the years. I'm grateful, Chief, to the department for all of the work that it's done in bringing a recovery-oriented message and a treatment-oriented message to the people of the province. So thank you all for that, and I'm thrilled to have been taken an opportunity to be a part of it. Thank you.
Good morning, everyone. My name is David Stewarding. I am a member of the Vancouver Police Department, but also I'm a member of the Odd Squad. First off, I just wanted to thank Chief Adam Palmer, Superintendent Michelle Davey for their support of this project, not just giving us a thumbs up, but actually being involved with us throughout its development. It's been very important, very rewarding for us. I wanted to thank our supporters as well, Telus Community Fund, Face the World Foundation, the Vancouver Police Foundation, and the Safer Schools Together program, especially Teresa Campbell, for helping us develop the online or the resource guide. Also wanted to thank some other people that were involved in the project, Captain Steve Fulmer from the Vancouver Fire and Rescue Services, and also Brian Twaits from BC Ambulance Service. It's one thing to support a program, but it's also something to put yourself out there and being recorded as you're doing your job. Odd Squad has been committed to providing a prevention and education message to youth since 1997, and we've done that through reality-based images in presentations and also documentary films. We started this project in 2015, and it was 4 kids, and sadly it was because of 1 kid, and that continued on getting to meet another family and the result of addiction taking their family down a really dark path. I just wanted to recognize Mark Bodie and Michael Taylor this morning for taking the time to join us. They have opened their doors to a very dark part in their lives, and they've continued to do that for us to this day. Also wanted to thank the Walker family who are in Victoria. For us, we focused a lot about addiction in the downtown east side. This was a departure for us because we knew that fentanyl was going well beyond the downtown east side. So we started to go into smaller communities. We went to Victoria to talk to people that were suffering for it. We were talking to people in Vernon that were also witnessing firsthand what was happening as a result of fentanyl overdose. Very important to us is that. The modules themselves, there's 3 modules. They're focused around the development or the onslaught of fentanyl in the downtown east side, but as it grew, and we followed the 3 families as they struggled with the consequences of their loved ones going through addiction. What was important for us is that we didn't have just a film for kids to watch, but there were some lesson plans and there were some learned outcomes that was very important for us to kids to learn in that. And again, thanks to Teresa Campbell from Safer Schools Together for doing that. That's pretty much what I have. Thank you.
We're just going to play a trailer of what we have done.
I'm convinced that we're going to look back in history at this time as by far the worst drug crisis we've ever experienced in this country.
Scary stuff, especially when like you hear an ambulance going and you're like, holy crap, is that one of my friends again? Is that my girlfriend? Like within the last 2 weeks, I've never had 7 people.
People are coming to drugs because they're available, they're cheap, and they've got friends or social connections going, hey, let's just try it. Let's see how it goes.
Everybody tells you all the things that are scary and bad about drugs, but nobody tells you how much fun they actually are.
Everybody's running ragged nowadays. It's taxing on the body physically. It's mentally draining, and now we get a call.
There are different types of interventions that need to happen. Some don't make it.
If you were in a fentanyl lab,
get the hell out, because if you're not dead, you soon will be.
We're using astronomical amounts of Narcan to try and revive these people, 5 times the amount that we were using before to resuscitate, reverse these fentanyl overdoses.
On August 2nd, Jack and his friend stopped on Commercial Drive to buy a pill. They split it in half. One half went to my son, one half went to his friend.
Half of the tablet will result in a death with somebody, and their friend that took the other half of the tablet may survive.
And Jack died on the park bench at Shelley Park in Vancouver. If I were able to meet the person and have a talk with the person that sold the pill to my son, I would show him my family at times where we're shattered.
This is impacting people from all different walks of life across our city and across our province. We need to work together on this.
A drug-free life, improved health, positive, engaged citizenship. Those are the goals that we have for people.
Very quickly for the media, there's copies of the resource guide and USB stick of the educational modules if you'd like to take one, and if you had any questions at this time for any one of us.
Obviously, it's pretty heavy subject matter. Is there an age range that it's geared more towards, like high school, older elementary?
Our target audience is probably high school, probably grade 7 and up.
And when will it be rolled out in schools in the province?
Basically, the way we've made it available is that we've secured funding from sponsors at our last year's fundraising gala. We can provide a copy free to every school in the province. They just have to get a hold of the Odd Squad at oddsquad.com or call us, and they can download a copy for their schools.
What sort of impact do you see with this in schools when they see products like this? You've done other things in the past.
Yeah.
What sort of impact do you see when you...
Well, actually, it was really important for us to get some feedback from kids early on. Once the modules were developed, we actually started to show them in select audiences. And actually, we developed, Professor Garth Davies from Simon Fraser University developed a feedback form for the students to weigh the impact before they saw it afterwards and just their impression of drug use, things like that. We actually scored quite favorably with kids.
And when you talk about the school modules, what's sort of involved in that other than the video itself?
Basically, the resource guide has a variety of lesson plans, whether it be personal reflection, individual assignments, group discussions, group debates for the classrooms, and basically it's how do you call it? It's a canned solution. Basically, the teacher doesn't have to develop anything. Everything's sitting right in the resource guide for them to be able to deliver the videos and then to do lesson plans with it right away.
Is there any other plans to do? I mean, you're dealing with fentanyl here. To do other sort of projects that relate to drugs or?
Well, we've been around since 1997. There's a lot of projects we'd love to be able to do. So maybe we can talk to the chief about it afterwards and get him to commit to us.
But plus also, you've done some great projects historically as well with methamphetamine and other drugs.
Absolutely. Yep. Thank you.
Well, today is the first day of legalization of marijuana, but there are people saying that this is still a entry level or a gateway drug. So how do you correlate fentanyl use with when young kids trying pot at school?
Well, you know what? For Odd Squad, our message has never been about what's legal or illegal. We've looked at the subject of substances and how it has an impact on the body, whether, like I said, it's legal or illegal. So if it's caffeine, if it's nicotine, if it's alcohol, or if it's illicit substances or marijuana, for the young developing brain, nothing of that. None of those are good for the young developing brain. So our messaging hasn't changed simply because something has become legal.
What's the title of this video?
The series, it's Odd Squad Beat. It's the Odd Squad Beat Understanding Fentanyl series.
Understanding Fentanyl. Do Do you think this will save lives?
I believe it will. I think the one thing that's long been overlooked is the value of prevention and education. And we've been doing that, like I said, for 21 years. I think there's some value in it. We're getting positive feedback from kids, and we're now talking to people that are in their 30s that saw through a blue lens 20 years ago, and they said it did have an impact on them, and they did make a decision that they weren't going to use as a result of it. Is it an absolute solution? No, it's one piece of the puzzle.
So this is like the new version of Through the Blue Lens?
Yeah, that's a tough one. Yeah, no, I think that was groundbreaking. I think we've learned a lot as Odd Squad over the years. You know, there was no resource guide. I think we've learned a lot over the last 20 years how to develop something and how to deliver it to a target audience for us, which has been students. So
the strength of this thing is that you've got a partnership with educators. You've got a partner. It's done properly, and it's basically you know it's going to work.
Absolutely.
You tested it.
Yeah, well, it wasn't developed in a silo simply from the perception of police officers walking around. We spoke to a lot of people before we even started filming, and you know, we did our research on it, and we got people involved early on, so to take it in a direction we wanted it to go.
I understand there's a conference this week, maybe?
So this Friday. Yeah, this Friday, October the 19th, Odd Squad is hosting a conference, a variety of guest speakers coming to talk about the issues of substance abuse, primarily how it pertains to youth. That's in Vancouver. You can go to oddsquad.com for more information. Also, we're holding our annual fundraising gala. We are an independent foundation. We receive little funding from government agencies, and the majority of our funding comes from private and corporate sponsors who believe in our messaging.
Thank you.
Thank you.
Thank you.
Hey, Chief. Pleasure. I was not at the press conference Monday. And that's nothing new. We know that there's about 4.6 million Canadians that use marijuana, as per the latest Statistics Canada numbers. So it's readily used in our society, and those 4.6 million people have been getting it from illicit sources for decades. So we know that as we move from an illegal regime to a legal regime, that there will be some growing pains. It will take time. It's not going to happen overnight. But we're hoping that as we do go to this store model, that organized crime will be pushed out and it will go to a regulated government framework, which is how it's supposed to work. Thank you.
Thank you, Chief. I'll be available for any questions afterwards if you have any, but we'll just excuse our guests now and thank everybody for coming today. Thanks.